Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Haris bin Latif Muhammad. Student PhD from USIM. Today I'm going to present the topic of psychospiritual career counseling module therapy for drug inmates. Before I proceed, here is the outline of my presentation. I'll start my presentation with introduction of the study, followed by problem statement. Purpose of the study, literature review, methodology, data collection, result, and lastly, the conclusion. So for introduction, as we know that our country had declared drug as a #1 enemy of the country. It is declared back in 1983. Since then, many type of treatment of drug introduced by government and private rehab institution, but sadly, we are yet to find a very effective type of treatment that suits the drug addict. Researchers such as Rafidi in 2015 say that the current addiction treatment and rehabilitation program generate disappointment result, and it is because of the relapse issue that our inmates are facing. According to Sabri in 2007, there is evidence of drug addict relapse after being discharged from a recovery program, and that is implied existence treatment plan should be revisited or replanned to ensure that the drug addict do not relapse after being discharged from a rehab center. United Nations Office of Drug and Crime, UNODC, in 2008 stated that career and vocational skills as an important component in managing recovery process. Inmates or drug addicts become relapse because of unemployment factor, as mentioned by Azlan and Muhammad Nazar. And that is why ADK set up a program called CCRC as one of the module treatment of ADK. Moving forward to the problem statement. Research done by Fauzah Ibrahim and Wong mentioned that most of people who already undergo the treatment are not ready to confront the outside world. Among the issues that they're facing is a lack of career skills, high unemployment rate, and also in terms of previous research, Amin Al-Hadi in 2017 and his team mentioning that there is a need to come out with a career spiritual module study to assist the drug inmates. According to Canadian Association of Occupational Therapy, there is a need to evaluate existence career module therapy to ensure its effectiveness. Hadi stated that drug addiction problem encompasses of alteration of human biological, psychological, social, and spiritual aspect. These statements supported by Ridwan in 2017 suggested that the treatment of drug addict should be comprehensive, focus on human body, including spiritual, mental, moral, and physical. Because we know that the relapse is a disease, a biopsychospiritual disease. The treatment of drug addiction should be holistic, addressing all aspects of human body, including spiritual, mental, moral, and physical dimension. Issues related to drug addiction, particularly when combined with a lack of career skill and high unemployment, are multifaceted and can have a significant impact on individual and society as a whole. To address this issue comprehensively, a holistic approach to addiction treatment is essential. This approach should not only focus on detox and recovery, but also encompasses mental health support, vocational training, spirituality, and reintegration of programs to help individuals rebuild their life and become productive members of society. So the purpose of this study, the aim of the study is to compare the pre and post test of psycho, spiritual, and career planning element in Psychospiritual Career Counseling Module Therapy PCCMT for drug inmates at Rumah Sahabat Ceras. On the literature review part, there are a lot of literature review related to discuss a topic. Here are some of the literature review for psychospiritual and career planning. Muhammad Rusdan and Dini Farhana in 2014 studied entitled Psychospiritual Approach in Drug Addiction Treatment stated that study found out that the residents show a positive response to psychospiritual approach use. In fact, they also agree that the spiritual aspect is an important element in helping the recovery of an addict. Another study conducted by Western Studies has also shown that psychospiritual approach are an important holistic approach in rehab treatment. Employment serves as a vehicle for integration, helping them assimilate into mainstream world, particularly after detoxification and rehabilitation process. According to Plaid, 1995, career therapy as advocated by Canadian Association of Occupational Therapy in 2017 can assist individuals with substance abuse issues in identifying their strengths, values, interests, resources, and challenges to develop a recovery plan. However, those in recovery often face obstacles when seeking employment opportunities. So this experimental study aimed to examine the effect of the researchers psychospiritual career counseling module therapy PCCMT on the study sample. And according to Creswell in 2015, experimental research is a method employed to investigate whether an idea, procedure, or practice has an impact on the variable under examination, as noted by Shaughnessy 2012. One of the notable strengths of experimental research lies in its ability to establish causal relationship. Experiment also enable the researcher to determine whether an intervention or treatment can bring changes in the observed behavior. Chua 2013 explained that the experimental research design is structured to assess the effectiveness of a program by emphasizing comparison between two or more sets of data. The experimental design instills confidence in researcher that the observation made in the study can be attributed to impact of the program. As outlined by Creswell in 2015, experimental studies that involve the comparison of sample group can be categorized into pure experimental, quasi, and factorial design. Among these, true experimental studies stand out as the most robust method for assessing the effectiveness of an intervention since it incorporates a completely random sampling. Moving forward to the data collection and result. Based on the table 1, result shows both PCCMT variable, psychospiritual and career planning p-value are at 0.001, indicating that there is statistically significant difference between pre and post test for both. It appears that there are significant changes from before and after experiment. The PCCMT module had a beneficial effect on the experimental group, leading to positive changes in the mean score before and after the study. Enhancing psychospiritual and career planning in the post-study phase can raise awareness and improve coping mechanism for dealing with drug abuse. Substantial prior research has demonstrated a noteworthy and well-documented protective association between spirituality, and substance dependence, as evidenced by study conducted by Miller in 2007 and Bonelli and Coing in 2013. Research conducted by Haynes in 2007 suggested that religious and spiritual experience played a role in fostering positive attitude towards stressful situation and improving coping abilities without the occurrence of relapse. As a conclusion for this study can help academic, government agencies, and community leaders to identify the extent to which the effectiveness of PCCMT program can increase psychospiritual values as well as individual career planning awareness. This study show how important psychospiritual and career planning element play a significant role in being a shield preventing the inmates from substance and drug abuse. Yes, thank you and Assalamualaikum warahmatullahi wabarakatuh.